Welcome to Elite Expert Insider Podcast, where we will inspire, motivate, and educate entrepreneurs, innovators, and growth seekers. Brought to you by Elite Online Publishing, making the best and brightest in the industry #1 best-selling authors. 80% of people say they want to write a book. We're assuming that's the same for you. If so, contact us at www.eliteonlinepublishing.com and make your book a reality. Hey, Melanie Johnson here with another great podcast for you with my business partner and friend, Jen Foster. How you doing, Jen?
Hey, I'm doing great.
Well, we have another super great podcast for you today. If you are frustrated with your doctor, your healthcare, feeling like they're not really giving you the time and attention you need and not trying to pay attention to the whole person and cure the whole person versus just doing something in between. So listen, we're going to have a great podcast today. We're going to answer a lot of those questions for you. We have Saundra Dalton-Smith with us. But first, we want to remind you to subscribe to the podcast right here. Hit the subscribe button. Do that right now, because then you'll be alerted of all the great guests that we have. So we're going to get started. But also, I want to remind you, if you're thinking about writing a book, we'd love to have you submit your request to Elite Online Publishing. You can go to our website, and right there, you can submit your request to become an author with us. So welcome, Saundra. Thank you so much for coming.
Thank you for having me.
So Saundra's written 3 books. She is a doctor. She has had tons of experience with this. So we're going to get in deep. Tell us a little bit about yourself, Saundra.
Well, I'm a board-certified internal medicine physician. I've also taught classes on health and disease progression. I currently write and help people overcome their burnout situations. I help people kind of learn how to incorporate rest into their work days so that when they finish their day, they actually still enjoy their life.
That sounds great. So what are some of the biggest problems you're seeing people face with when they walk into your office? What are the most common things?
Well, that's the thing. Most people, when they come into my practice, they're coming in because they're tired all the time. And many don't associate that with burnout, or they don't associate that with needing to incorporate a rest deficit. They think something is chronically wrong with them. And occasionally that can be the case. But for a large number of people who are coming in, they don't have adrenal failure. They don't have thyroid disease. They actually just have a chronic rest deficit. And so it's helping people determine when they actually have a medical problem and when they have a lifestyle problem that actually needs to be addressed.
Wow. I think that's really important nowadays. I mean, with high demand with work or self-employed or, even any entrepreneur that owns a business, and you don't think about, it's not really talked about in America, like to help yourself or to go on vacation or to make sure that you are looking at yourself first and helping yourself. It's all about, making the money and making sure your kids are good. It's not, no one ever talks about self-care or making sure you get enough sleep or making sure you're, those kind of things.
And what I find is often what I'm finding is that when people do talk about it, they talk about it in such generalized terms that it's no longer beneficial for people. And that's really where I started kind of diving in deep. I reached my own level of burnout where I wasn't enjoying a career that I'd spent, tons of years. It felt like getting ready for, training for, and doing all of that. And then when I got the career that I had been preparing for, I just really didn't feel like it lived up to its expectations. And the thing with that is, I think a lot of people feel like that. They reach their goals or they reach what they think they want to accomplish, and it really isn't what they imagined. And I think a lot of that has to do with we don't take the time to appreciate really those successes. We're always looking for the next thing. We're always kind of pushing for the next thing. And that's part of what rest does, and learning how to intentionally live a lifestyle of rest so that we're constantly enjoying our lives.
I think it was Anthony Robbins talked about how you reach a certain pinnacle and you're expecting that to bring you the happiness and joy you've always been looking for, and you get there and it's not there because it kind of starts within yourself and like say, taking those moments along the way. So what is the prescription for rest? Are we talking just getting a good night's sleep, or is there more to it than that?
Yes, there's more to it than that. When I started really diving into rest, my background's biochemistry. So when I look at problems, I like to look at them kind of from the smallest minute aspect of it and then kind of go from there. So I did the same thing with rest. I started looking at when most people talk about rest, they are talking about sleep. And so unfortunately, sleep and rest are completely different things. Sleep is just one tiny aspect of it. When we look at rest, we have 7 different types. Of those, which are physical, mental, emotional, spiritual, sensory, social, and creative. And sleep is a type of physical rest. It's a passive type of physical rest, But you also then have active physical rest, which are things like yoga or body stretches or massage therapy or even a leisure walk can be considered physical rest if the focus is not on exercise and really more on improving the lymphatics or restoring cardiovascular flow. It really depends on the intention behind the activity.
So let's talk more about that, the last part you're talking about. So the physical, is that when you say going on a walk, does that also take in the mental too? Or, I mean, I know a lot of people who are like, oh, they need so many steps a day and they've got their Fitbit, but then they're not thinking about the mental aspects of that walk. Like they're just thinking about they got to work out. So tell us a little bit about that.
Yeah, so when we're looking at the 7 types of rest, you can get more than one type at the same time. So I have some patients who have a big issue with social rest. They work in toxic environments around people who are depleting to them, who drain them. And so they have girlfriends or friends that when they're around, they have that life-giving aspect of being in the presence. Being with them actually restores them and makes them feel better. So for them, maybe taking a walk with a girlfriend, you're getting both the physical part of it so that you're not trying to race walk each other and you're not increasing the body's stressors. You're actually de-stressing the body because you're doing it at a leisure pace, but you're also getting that social rest in that you're having someone that you can share your day about without the fear of them judging you. Someone who their presence actually makes you feel better.
How do you do the emotional rest? Because there's so many times I think stress plays into it, whether people are having maybe stress at their job or their health or an ex-husband or, their kids are making them crazy, and all that rides into your emotions where maybe you're getting angry, you're getting sad, you're getting, how do you get emotional rest?
Well, emotional rest is really about being authentic and being able to tell your truth without apology. And I think so often we feel like we are not able to express ourselves in a way because even our own personal boundaries kind of get skewed because we're afraid of the confrontations that come with letting people know how we really feel. But honestly, personal boundaries by nature are confrontational, and that's what a boundary is. There has to be a line and there has to be an understanding of kind of the demarcations around your life, around your emotions, what you are willing to accept and what you're not. And I think so often we don't have an expectation of what we want for our own emotional health. We just kind of go into it in reactive mode. Whatever happens, I'm going to react to it without having kind of a foundation of what you want your emotional health picture to look like. And I think that's important for most people to kind of in their mind even think about, what does emotional healthy look like to me? What does that mean? And if we don't have a picture of it, then it's almost impossible to attain because we don't know when we're getting pulled off track.
I like that. Yeah, it's kind of like goal setting. I mean, we set goals all the time, whether you're working for a corporation or entrepreneur, setting these goals and you look back and you assess. But how often do we set goals for our emotions and say, this is like the picture you were saying, the emotional picture that I want, and what are those things to achieve that? Or when something happens to me, instead of reacting in this way, I'm going to choose to be in this other emotional state because I want this. I have that image.
And part of that isn't so much a choice because sometimes events happen in our lives, so to speak, that we have only one way of responding. Let's say an unexpected death. Sorrow is the only way to respond. But when we have an emotional picture of what our emotional health should look like, we don't accept being depressed and down as being the state that we will remain in. And I think so often when people feel down, they feel like things are never going to change. It's no different than when someone has an image that they want to, get to a level of health within their body where they are not tired when they go for a walk or play with their kids or grandkids. When we see things like that, we aspire to that. We should have those same aspirations for our emotional health, that we can feel whole, we can feel accepted, we can feel happy, and we can feel energized and joyful about our lives. There aren't going to always be those days every day. Every day is not going to look like that, but that is what we are aspiring to.
Good to have those guidelines. So let's transition a little bit about the conversation about treating the whole person. And I know you're very big on that. And I was telling you before the interview how I have Graves' disease and went to my thyroid doctor, and I just feel like, it's just 10 minutes if I'm lucky if I get that, and not treating the symptoms, the stress, anything else that maybe is going along with that. So tell us what we should expect and how we can treat the whole person.
Yes. Well, that's really a talk that I give a lot of times to physician groups, because medical school isn't training doctors to really treat in a functional medicine aspect. They're training doctors to get them in, get them out. And really the insurance companies are reinforcing that, because to keep the salary at what most doctors are accustomed to, or what they anticipate when they come out of medical school, you're having to see patients every 10, 15 minutes at the most. And so that does not lend itself to a teaching mentality, which is really what medicine was supposed to be. It was supposed to be more of a preventative type of science, rather than a corrective type of science, where the focus is solely on problem solving and not problem prevention, or teaching people how to overcome certain medical issues. And so I think what a big part of what I do is, when I'm talking to residents and at medical schools, is we take a look at, if we teach the patient how to care for themselves, you can still see more people, but the quality of care you're giving is so much greater. And what ends up happening is you get more referrals, because people don't like feeling like they're just another number on your schedule, that they're just someone you're checking off. One of the biggest complaints I would get from patients who would come in as a new patient to me from another doctor who I know is well capable would be that they sat at their computer and they looked at that electronic medical record the whole time, and they never really looked at me when they talked. They were always typing and looking at the computer. Yeah. And so you can't connect with a patient like that. And they don't feel comfortable even sharing some of their deeper truths with you, so that you can even determine whether or not they're having an emotional issue or a social issue or anything else that may be really at the root of what their medical problems are.
I think that's so true. I mean, you don't get the answer. Like, let's say you have someone who is maybe a big drinker and they're having issues, but if you never ask them about their lifestyle and what's going on with that, or have they had stresses, what's been happening lately that maybe has caused something to go out of whack, or why they're feeling a certain way. If you're just saying, oh, you've got this problem, let's think about the drug, and not looking at the whole picture of everything, you know?
Mm-hmm. And it really just creates a downward spiral, because what happens is the patient comes in, they say, this hurts, this is out of balance, this doesn't feel right. They get a medication, they go away for 3 to 4 months, they come back, now they have another problem, they get another medication, and then before you know it, you got a 50-year-old with 7 pills, of which they may need one, truly may need one for high blood pressure or something, but all of these sleep aids and diet pills and all of this other stuff are things that really could be treated if we taught the person how to care for themselves.
Yeah, let's talk about some of those things. So what are some of the things in your book that you talk about on how to take care of yourself, physically, or, with eating or with rest? Like, what kind of things do you recommend?
Well, what I start most of my patients with is I have them start with an assessment to really find out which of the 7 types of rest are most deficient in them. And I do that at restquiz.com. It's a free assessment that gives them, I don't want to say a score, but it gives them a number for each of the 7 types of rest, so they can see where they're most deficient.
What is it called again? What's the website?
It's restquiz.com.
Okay, and we'll put that up on the bottom.
So once they take the assessment and they see which of the 7 types they're most deficient in, then we kind of deep dive into that one. So one that a lot of people tend to have a problem with, particularly with being able to sleep better, because that seems to be a big issue. People have very poor quality sleep. They go to bed, they wake up, they're so tired, their body aches, their mind's not clear. So we talk about just a really basic bedtime routine, just so that people can start getting into the mindset of what rest feels like for them. And so, for instance, with the physical aspect of rest, we'll have someone do a body analysis. What hurts? Before you ever get into bed, is anything tense, tight, or uncomfortable? And most of us don't do that. We don't analyze what our body feels like, but your body is trying to always tell you when there's an issue. But if we don't shut up long enough to listen to it, we'll just keep ignoring it until it grabs us to get our attention. Hence the heart attack, the stroke, something that you cannot ignore any longer. And so we teach people to try to start out evaluating, what does your body feel like? And so if you have neck ache or body ache or back pain, then we can look at what's going on in your day that's feeding that. Because for most people, it may be their posture when they're sitting at their computer, or it may be how they're holding their phone when they're talking on it. I mean, there's a list of things that could be causing it. But when you get into the practice that this week, I'm going to analyze my body, then when you start feeling those pains, you can quickly identify what you were doing before it and find out how to correct that situation. Another one is just having kind of this what we call monkey brain, where your mind's just racing and racing. You try to lay down at night and you think about your to-do list the next day, or you're thinking about what you need to put in someone's lunchbox the next day, or kind of running through all those ideas. Or you could even be doing the woulda, coulda, shoulda conversation, where you had a conversation with someone and you wish you'd said it a different way or handled a situation a different way, so you kind of ruminate over that conversation. Yeah. Those are the kind of things that keep people from going into deeper sleep, because the mind says this must be important, so I'm going to hold on to this and not let it go, even though that is when you're needing to go into deeper sleep. You need to let it go to be able to rest well. So for many, keeping a journal at the bedside, honestly, could be a Post-it note. It doesn't have to be something big or fancy, but just a way to concretely write down whatever it is that's running through your mind, so that it gives the mind permission to let it go. Because now it's saved, it's preserved on that piece of paper, and you don't have to try to keep it in your head. You can release it so you can actually go into a deeper level of sleep.
I love, I've been using, lately I've been using Siri. My son uses Siri all the time. So I've been like half asleep or woke up in the middle of the night, had that monkey brain going, and I say, hey Siri, remind me to blah, blah, blah. And then I know it's in my phone and I don't even have to write it down. I can just talk it from my bed.
That's fantastic, because, so often people say, well, shouldn't I not do electronics right before I go to bed? The thing with the electronics isn't that the electronics in themselves are bad. It's often how we use them that are bad. We can use anything to work for us or against us, and that includes our electronics. So I think that's a great example of really how to use your electronics to work for you to live a more restful lifestyle.
I love that.
Do you think you can have a doctor explain to the doctor the type of treatment that you want, or you really just have to find the right doctor that does that? Because either it's one way or the other, or...
It's personality, because, we have some doctors who, particularly, I hate to put it like this, but older doctors who were trained under the mentality of, you are the authority, you are the doctor, the patient has no say-so. It is not a patient-focused, patient-friendly atmosphere in some situations where you have doctors who were trained under that mentality. However, most of the doctors that are coming out of training now are coming out with a more patient-focused, patient-friendly way of treating people. And that includes actually getting the patient's input on the care they desire, because people are more likely to follow a treatment plan that they believe in and that they understand. And the key right now is that most people are given treatment plans that, first of all, they don't understand, so there's no way they can believe in it, because they don't have the information to make a judgment call about what they're being given.
So true. I can only relate to, like I told you, I had Graves' disease, still have Graves' disease. And when I asked my doctor, is there anything else I should be doing? Should I have changed my diet? It's an autoimmune disease. Should I be doing something to boost my immune system? Whether it's diet, vitamins, exercise. No, just take the medicine. I was like, really? Just take the medicine? It seems like there should be, your immune system's down. So it was my first red flag. I should have fired her.
Well, the thing with that, to be honest with you, that doctor probably doesn't know because if that's a doctor that's not trained in functional medicine, or that doesn't have a personal interest in it, there's nothing in medical school that would teach them about the nutrition aspect of it, the vitamin aspect of it, aromatherapy. There's nothing in medical school that would teach them about that. And so what I prefer for physicians to do when they're in that situation is to be upfront. We're not supposed to know everything. We're supposed to know about what we've been trained on. Right. And so there's no fear in saying, I have no idea what essential oil you should use for that. That's not my field. But I'm not against essential oils. Why don't you bring in some literature about what you've looked at? We'll take a look at it. We can then compare it with your medicine, see if there seems to be any, interactions. This is what I do with my patients. And then they'll say, well, do you think it's safe? And I honestly tell them, I don't know, because the literature doesn't let me know if this blood pressure pill works with this. But from what I see, we can monitor your response to it. And if we notice a change, then we know that this isn't going to work for you. But I don't give them any guarantees about things I don't know. We just work through it together. And they can make the judgment call if they're willing to take that risk that, okay, I'm using an essential oil. My doctor's already told me she doesn't know if it works with my blood pressure pill, but everything I'm reading in the literature seems to say, and they can kind of make an educated guess. And because that's really all any medicine is. It's an educated guess. And so people are not stupid. And I think that's the misconception that medicine kind of throws at the patient. The patient is stupid, the doctor is smart, so you always do what the doctor says. You know your body. Everyone knows what their body should feel like. And so sometimes when I have people come in and they say, well, the doctors tell me all my tests are normal, I should feel fine, but I don't feel fine, I feel horrible. Mm-hmm. That person knows their body. Something is off. And so it's my job as a care provider to care enough to want to help them figure out what's going on, whether that's medical, physical, social, mental, whatever that is. To me, that's what true healthcare should look like, treating the whole person so that they feel healthy and whole.
I love that. That's great. Well, where can people find you, Saundra? Where can people go to get more information or to even use you as a doctor?
My website is at ichoosemybestlife.com, and there's a resource section that has a list of all the free resources that we offer, including the rest quiz.
Great.
And of course, since she's an author, she's on Amazon. You can find her books on Amazon, and her author page tells you her whole bio and everything else about her. So you can find her there as well. Well, thanks for coming for another great podcast. Remember to subscribe to this podcast. I hope you got a lot out of it. I got a lot out of it. I think Jen got a lot out of it too. So if you're looking to become an author yourself, make sure you reach out to us at eliteonlinepublishing.com. And for that thing about writing this stuff down in the middle of the night, we suggest you use one of our journals. We have a bunch of them under Elite Online Publishing. We have thousands of journals, so go check those out as well. We'll see you next time.
Bye.
Bye.
If you'd like to create the most powerful advertising tool for your business, contact us at eliteonlinepublishing.com, where we will help you create, publish, and make your book a #1 bestseller, and show you how to get new leads and more revenue for your business. If you'd like to check us out on our Facebook page, we have a free book for you as our gift. Just go and click free book. Remember to subscribe and leave a comment for our podcast. We would love to hear from you.